Hi, my name is Marin King, and I'm the Marketing and Communications Manager at CenterPointe. I'm here today with CenterPointe staff to learn more about the Crisis Response Program. Amber, do you mind introducing yourself?
Yeah, so I am Amber Dirks. I'm the Senior Director of Community Response here at CenterPointe.
My name's Brianna Werger, and I am the Crisis Response Team Lead here at CenterPointe.
Thank you for being here. Can you tell me what the Crisis Response Program is?
Yeah, so back in 2020 when we got awarded the CCBHC grant, so Certified Community Behavioral Health Clinic, that is really when crisis response started to expand a lot more. We were able to take our mobile crisis response from being for primarily youth and family to expanding that out to law enforcement and being able to utilize that service with adults as well. And really since then, we've been able to kind of hit all three areas of the idea of someone to call, someone to respond, and somewhere to go.
And what does it mean to have a mental health crisis?
So when I think about mental health crisis, it really is identified by the individual. What I think is a crisis versus what maybe Brianna thinks is a crisis could look very different. So it's somebody maybe experiencing some sort of distress, or they're feeling overwhelmed, they need some additional support, they need coping, they need resources. It can be a whole lot of different things based on who the individual is.
And you mentioned someone to call. Your crisis hotline, who can utilize that and what's the benefit of that?
So with the Crisis Hotline, it's 24 hours a day, 7 days a week. We're open all of the time. Anybody can utilize it. They can utilize it anonymously. They can give us their name if they want to. They can call us for whatever their crisis is. We can give them resources over the phone, and we can listen and give them some coping skills over the phone to get them through that current mental health issue that they're going through.
What is the most rewarding part of working with crisis response?
For me, it's been really just seeing the expansion and the development with the community partners and really focusing on how do we decrease stigma around mental health, around suicide, around substance use, even when it comes to homelessness, and really focusing on how do we better serve the individuals in the community and get them that ongoing care versus putting them in a controlled environment that maybe isn't as effective or supportive to them.
For me, a lot of it is similar to Amber. It's seeing the benefits that it brings to a population that people tend to forget or are stigmatized. And so it's that satisfaction of knowing that they will reap the benefits of having somebody who cares about them and give them the resources to get them that hand up if they need it.
And if someone is experiencing a crisis, what do you recommend them do?
I recommend that they can reach out to our crisis line. They can also reach out to 988. We have a partnership with them. So we partner with 988, we partner with Lincoln Police Department, LPS, and Bryan West. So they can reach out to any of those entities and they can utilize us. We can meet them where they're at that moment as well.
And if someone wants to talk to somebody face-to-face, is that an option as well?
Yes, they can come into Campus for Health and Wellbeing here at CenterPointe on Mondays through Fridays from 8 a.m. till 5 p.m. And they can speak with one of our crisis response members and be able to process that crisis that they're going through at that time.
Do you have any future plans for the crisis response program?
Yeah, so I mentioned that somewhere to go. So currently we do serve adult, youth, and family, but as far as the somewhere to go, we're going to be expanding that further with a program called Square One, and it's really going to be an expansion of our current crisis services. So that'll include having crisis walk-ins for youth and family experiencing crisis. We'll have crisis psychotherapy, which would be meeting with a therapist. We'll have emergency community support for individuals who need some ongoing support after meeting with us, whether that's in respite, so that'll be another component of that, having 4 respite beds, or if they had a walk-in and they need some additional support, additional resources, that will also have those services available to them as well.
That's great. And who makes up the crisis response team? If someone were to come in, who would they talk to?
So they would come and speak to a trained crisis professional. That would include somebody that is specializing in peer support, crisis team members, a case manager, a therapist, or a counselor.
That's great. And if someone were on the fence about calling the crisis line, what advice would you give them?
I would say to go ahead and call. It's confidential. We don't record the calls. You don't have to give your name. It's anonymous. So I know a lot of people think that they might be judged, but the team members that they speak to have been trained in those things with active listening and just the genuine empathy that they have for the people that we work with.
Now, what do you think sets CenterPointe apart from other organizations in the community response program?
I think one big thing is that, one, we take a harm reduction approach, which is something that is different from what a lot of people maybe believe in. And we also really try to stay person-centered. We focus on language, how we communicate with the individuals, how we talk about them, and how we describe what they're experiencing. I think also the other thing that really sets us apart is that we really focus on finding like what the community needs and trying to find new innovative ways to meet the needs of the community, whether that be community partners and building those partnerships or with the individuals that we're serving.
In 2023, CenterPointe saw over 800 walk-ins to their campus for health and well-being and received over 3,500 calls on the crisis hotline. The need is there. Thank you both so much for all that you do and for joining us today.
Thank you for having us.
Yes, thank you, Maren.